morning. Thank you for joining us for this edition of SBB University. We are talking about resources to keep you safe in your home, aging in place. I am delighted today to be joined by Ms. Lisa Robbins, who is with Hand in Hand Care. How are you this morning, Lisa?
I'm doing great. Thank you. How are you?
Wonderful. Thank you. We
Thanks for
also
having
have
me.
Ms. Frankie Alonso joining us here. How are you this morning, Frankie?
I'm doing great, getting this holiday weekend started.
Yes. So we're going to just talk a little bit about each of you. I want the viewers and readers to know who you are behind the scenes. So Lisa, we'll start with you. Tell me a little bit about yourself and how you got interested in care management and your why, like really what really makes you tick.
What makes me tick? All right. Well, my name's Lisa. I'm a registered nurse, RN, BSN. I'm recently a certified care manager with ALCA, Aging Life Care Association. I've been a nurse for going on 17 years now, and I've done all aspects of nursing, hospital nursing, skilled nursing and rehab, administration, education, all of that good stuff. So I've the whole gamut of nursing, but my last couple of years of nursing, I was working in skilled nursing and rehab, and I was watching these patients come in and out of rehab, and I would help with their discharge process. And we'd always ask, who's going to help you at the time of discharge? And they didn't have that key person. They'd say, well, maybe a neighbor or a friend is going to help me. And unfortunately, there were so many times that we would see them come back just weeks later or a month later with the same problem. And I knew in my heart, if they had that support person that they needed, we could keep this from happening. And then while I was watching that happen, I had my own personal situation where my mom became quite ill, and she was wanting to age in place, stay at home. You know, she was young, she was in her 60s, wasn't going to go to a nursing home. So I got to see from that angle the daughter that works full-time with the mom with the health issues, and mom can't manage her appointments and her medications and her meals and her house cleaning. And I thought, this is craziness. How do people do this?
Yeah.
And like I've heard others say, I didn't know care management was even a thing, or I would have probably hired somebody. But I saw the need. I saw the need in the community, and I just felt such a passion for it, that to help people that wanted to age in place and stay at home. Because I thought about people like my mom. If she didn't have a daughter that's a nurse with that experience to help her manage all of that stuff, how could she do it? She wouldn't be able to do it. So that was really my big thing. That, on top of seeing the people in the rehab that just kept coming back through that revolving door. And I went out on a limb and said, this is what I'm going to do, because this is where I feel like I'm being drawn. And it's been an amazing 2 years, even with COVID. You know, you gotta love COVID, but we've made it through and learned a lot, and just really feel great making a difference in people's lives.
Yeah, and I'm sure your services were invaluable during COVID as well, because it's really difficult for families if they're not able to actually be in the appointments. People that are used to being able to sit down next to their loved one while they're at a doctor's appointment that weren't able to, at least you could be that in-between person that understands the clinical side of things. And I really always just love hearing people's why. You know, your why is very personal. You had a personal experience with your mother, and you also had that experience of watching people get discharged and come back because they didn't have the services. So
Yes.
That's fantastic. All right, Miss Frankie, Perfect Solutions for Seniors. You have a great story as well. Tell us a little bit.
Yes, it's funny. Me and Lisa's story are a little bit parallel because, you know, in my first life, I'm actually also a speech language pathologist, mostly with acute care hospitals and skilled nursing facilities. And that's kind of where my why came as well. As, you know, I have these great patients, they'd have a stroke, they'd make great progress. Those cognitive impairments were min to none. They were back to prior level of function. We get ready for discharge day. You're going home. How exciting. 3 months later, they're right back.
Yep.
And I said, hey, we had a home exercise program. We had cognitive exercises for you. We had swallowing exercises. No support at home.
Mhm.
And so in 2018, when my mom decided to do home care, she was having companion business started in 2005. But in 2018, we became a personal, non-skilled in-home care company. That's when I became incorporated along with my sister. And I was like, yes, I can actually get into these clients' homes. I can train our staff why it's so important to follow that home exercise program. And if there's a change in function, we need to report. We need to report it to a case manager. We need to report it to a daughter. And we are really those eyes and ears in that client's home to make them feel safe at home or wherever they choose to live.
Right, wherever they choose to call home, for sure.
Mm-hmm.
So we'll dive in with some questions. Now, at least, so there's so many different terms that are out there. There's geriatric care manager, there's aging life care specialist. I like to call you the daughter that I never had. If I needed a service like yours, what exactly is a care manager and how can they help you age in place?
So a care manager or aging life care specialist or any of those terms, it's somebody who's had special training in some sort of aspect of geriatric care. So be that social services, nursing, something along those lines that can help you navigate the healthcare system. Not just the healthcare system, but the aging in place system. Coming in, being able to do an assessment in the home, meet with the client, meet with the family. The family is such a major part of it that I think that sometimes gets left out when we have these discussions, but the family is a big part of it.
Huge.
But to discuss what are the needs? What do you recognize as the need? Because the family might have an entirely different perspective than what the true client would have. But what are the needs? What are the troubles that you're having? Managing meals, managing appointments, medications. Do you have chronic health conditions that you're having exacerbations or frequent hospitalizations? A care manager can help look at that whole picture and help put a plan together. Do we need to get Frankie services involved and get additional help in the home? Do you need somebody to manage the appointments, somebody to set up transportation? We're kind of like the ringleader on all of that. A lot of times families are able to do that and they want to do it, they're able to do it, and then there's times where they can't. Everybody has a different family situation. Families work, families are out of state, some people don't have families, and they recognize that there's a need, that they don't want to have to move into a facility, or they don't want to have to make these big giant life changes. They want to stay in their home, age in place, and they recognize that they need some sort of help doing it. And care managers come in, look at the big picture and say, this is what we can do to help make this happen.
Yeah, I've always said that my dogs are not going to take care of me when I get older. So I'll be looking for services like yours and Frankie's.
All right.
For sure.
Give me a call.
All right, Frankie, I'm going to bounce it back down to you. Now, there's a common misconception when people are calling on home care, private duty versus home health care or home care Medicare certified. So tell me the differences between the two, the payers, and when somebody would bring your services in versus theirs, and also like how you work together, because companies like yours do obviously work hand in hand with them.
Yes. So I always tell clients just think of it as skilled and unskilled. So skilled is that PT, OT, ST, physical therapy, occupational therapy, speech therapy, and nursing. And unskilled is that personal care, CNAs, companions, and we work together to support that client. I always go the extra mile in my background in speech language pathology. If a client has any therapy in, I'm going to contact that therapist and I said, hey, we have an aide in here. Do you have a home exercise program? What can they do during the hours there? Support your exercise that you do, because what people don't understand is that skilled care happens only a few times a week.
Right.
That PT is only going to the client's home twice a week. Then you have OT maybe once a week. It just depends what the needs are of the client. But our services support those skilled services that they're providing. So they really, really work hand in hand.
Mm-hmm, mm-hmm. They really do. So again, I would say that when you also have to have a doctor's order for that special service that you get through Medicare.
Exactly.
and you're going to get very
Thank you for reminding me.
yeah. And you're going to get really short visits too. Like with, your services, you're paying for multiple hours, or certainly you could probably even pay for 24-hour care. So it's,
of course, we do have a 4-hour minimum, but we go up to 24 hours. And of course, you said you need a doctor's order for the skilled services, and the unskilled services are our services. They are private pay. We also are Medicaid supervised or approved through Staywell. So we do have some Medicaid clients that we have on board.
That's great to know, because it's very rare. That's why I'm glad that you brought that up for sure. All right, Lisa, we're going to bounce back up to you. Now, even though you are a geriatric care manager and there's several companies that are out there, what makes Hand in Hand unique?
What makes us unique is with Hand in Hand Care, we are registered nurses. So when you have one of us come for a visit, when we're going to come see you, be that to accompany you to a doctor's appointment or a well visit or an emergency check-in, you're going to have those clinical eyes on you. We're going to be able to perform an assessment. Nurses are always assessing if you know it or not. We look at you. We're looking to, are you eating? Are you not eating? Disheveled? Have you bathed? We can kind of look at and take that whole thing in. So while other care managers have some of that background as well, we're able to assess it from the physical nursing aspect. So a lot of our clients have chronic medical conditions, and they can give us a call if they're feeling an exacerbation come on, or if they have family members that are out of state and they say, hey, I just talked to my mom. She doesn't sound well. She doesn't sound herself. She has a cough.
Yeah.
Something along those lines, rather than a care manager that's going to say, well, you know what, we need to send them to the hospital. They need to go get an assessment. We can say, you know what, we'll go over there and take a look at them. That doesn't mean that they're not going to have to go to the hospital, but maybe we can do, if they have COPD, maybe they need a breathing treatment. Maybe they need something just to kind of help get them over that hump. So the nursing perspective part of it is what really sets us apart and makes us different.
It does. And this question's not on your list. So if I'm catching you off guard, let me know. I apologize. But it just occurred to me, because you're a nurse, are you able to manage their medication, do their medication management, get their pills ready for them?
Yes, we are. And that's where, we are able to do that. We're able to, the medication management, pick up the prescriptions, deliver the prescriptions, set up the pill boxes. If they have medications that are injectables, we're able to assist with that, administer the injections, draw up, sometimes people need insulin, and in home health or home care agencies can do medication reminders. But if the client isn't able to set up their pill boxes or draw up their insulin, that reminder doesn't do a whole lot of good. So we work with different agencies to do that medication management. And then the other care providers can come in and provide those reminders and so forth to help that person in their home setting.
Perfect. Now, Frankie, when somebody's coming in for your services, another thing that's really important to note is you don't actually have to wait until you have a need to call you. In fact, you would rather them do that ahead of time. Now, talk to me about the terminology, because we have so many acronyms in this industry.
Oh, I know.
Yeah. So many. What is an ADL, and how does a home care company like yours provide services for that?
So an ADL is an activity of daily living, and under that umbrella would include toileting, going to the bathroom, dressing, bathing, making yourself a meal. So we have 2 levels of services. Caregiver companion is no hands-on care. So the Agency of Healthcare Administration states as soon as an aide or person needs to provide hands-on care, especially with dressing, putting on a shirt, pulling up a pair of pants, or hands-on taking someone to the bathroom, that is personal care and needs to be done by a home health aide or a certified nursing assistant. And it is a different level of license in the state of Florida. So those are those 2 levels of services and how they can help with an activity of daily living. A caregiver would maybe set up an activity of daily living, put the clothes on the bed, but they dress themselves. But an actual home health aide or a CNA providing that personal care would help actually put on the clothes for that client.
And I believe, and correct me if I'm wrong, but a Medicare certified company is not coming in to do those services. They are providing that skilled care, so they really don't touch that other stuff.
They can provide training to the aide that is part of their coding, or they can bill for that. But to get a patient dressed every session, to get a patient or to feed a patient, for example, for me as a speech therapy, I could not bill to feed a patient. That is a non-skilled service. So I would be training the aide how to provide food safely. Now that is a billable service for my skilled services.
Now talk to me about, because you obviously partner with a lot of different services in the area, but I know that, you know, working with Lisa at Hand in Hand Care, you guys have partnered on things together. Talk to me about what that looks like when you would bring in a service like hers. And then after you're completed, Lisa, if I'll ask you to jump in there and kind of give an example as well.
Okay.
Well, first off, my clients with a care manager are my favorite. They are my absolute favorite, because what it is just one point person. There's that one person that I need to talk to, that family talks to, that kind of controls the circus
Gatekeeper
of senior care.
Yes.
You know, they are the ringleader. And none, you know, with the game of telephone, if I talk to the daughter's going to tell the other daughter, then tells the son. And by the time they get to that son, it's a different message. Like, no, I didn't say that. Mom is fine. So, you know, I love case managers. They let me know when the appointments are coming. They let me know, hey, can the caregiver go with them to the appointment, which is great. We do that as well. I usually give our caregivers a sheet that they can fill out, but if a case manager can go, or a care manager, I prefer that because they have that clinical lingo and they're going to talk right there to the family afterwards. But yes, it's just that key point person that makes my job easier, and it makes the family more at ease that we're all on the same page.
Perfect. And Lisa, as far as how you partner with home care companies like Perfect Solutions for Seniors.
Well, we partnered in different ways. As a care manager, I will say, for example, a client has a doctor's appointment. So I can go to that client's house to take them to the appointment, because that is a service that we offer, is the transportation, if they're able to transfer. But say I get there and they're not ready to go. They're still in bed. They haven't. So I can get, as a nurse, I can provide hands-on care. I can help get them up, get them dressed, get them ready, put them in the car, take them to the appointment, do all that good stuff, come back, relay the information to the family, make sure, well, while we're at the appointment, make sure that the doctor understands why we're there and what our concerns are, so they can actually be addressed. And then take care of that whole aftercare part. But now what if we get back and that patient or client is, you know, she's going to need help getting undressed now. Who's going to help prepare the meal? Just depending on what that need is. And that's when having Frankie and her team come in, well, not Frankie, but having her team come in to help provide those additional services. Yes, our nursing care managers are able to do that, but it's not cost efficient. It's not cost effective to do that. So that's when we're reaching out to our team to say, this person's needing assistance. You know, and maybe it's not every day. You know, a lot of times we'll work together and we'll kind of tag team. Hey, we've got an appointment this day. I'm going to come in. I'll help get her dressed. I'll get her ready, take her out. But when we get back, she's going to need this kind of assistance afterwards.
Right. And I'm sure your care managers have a number of people that they're taking care of. So to put that much energy on the front end and the back end with every single client would probably be not only exhausting, but unrealistic.
Exactly. And again, it's it turns into a cost effectiveness and cost efficiency for the family. You know, there are lots of services that we can provide, but ethically, it's not, it's better off for them, for us to make that referral to another service.
And that's great that you're looking at their finances and understanding that there's a better cost effective way to do it, because it also, again, just makes you that daughter they never had that's looking out for them. So
Yeah, exactly.
kudos to you and your team. Kudos to you, Frankie, and your team. And I'm so glad that we have such a great partnership here in the Southwest Florida area, that we can all work together so effectively and be that resource. But without further ado, I just want to thank you so much for coming on the show today for this edition of SBB University. For all of our viewers out there that have any questions, please put them in the chat and these ladies will get your answers to you right away.
Thank you.
All right. Thank you both.